Hello, Doc.
Hello.
My daughter Emma was sent home to quarantine because her classmate tested positive for COVID, but she was a close contact. What does that mean?
Well, let's talk about it. I will explain how you get infected and what you need to know about being a close contact and quarantine. The virus is spread in two ways. The most common is by respiratory droplets. These droplets are released by an infected person who coughs, sneezes, or talks. These droplets can travel up to 6 feet away and then fall on the ground. On the way, they can get in your eyes, nose, or mouth directly, or when your hands touch a contaminated surface and you then touch yourself. Airborne transmission may be less common, though we are still not sure. This happens when small droplets are released in the air while breathing. They can remain in the air for several hours before they fall to the ground, and they can infect anyone who breathes them in during that time. It takes 2 to 14 days to show symptoms if you get infected. You are a close contact if you have been 6 foot or closer to someone who has COVID infection for more than a total of 15 minutes during a 24-hour period. Quarantine means that you have been a close contact to someone with COVID-19 infection, and so for 14 days after the last time you were in contact with them, you need to stay home and away from other people. This is because for 2 to 14 days after the last contact, you could develop symptoms, have COVID illness, and spread it further to other people. If you are a close contact but have had a positive COVID test and illness in the last 3 months, no quarantine is needed, since studies show that you cannot catch it again. Also, the contact of a close contact does not need to quarantine. During quarantine, you should stay home, stay away from people who do not live in your household. Take precautions to protect any household member who is at increased risk. Check yourself for symptoms, including fever, and if you get symptoms, contact your doctor for advice. If you have a negative test during the quarantine period, you still have to wait until the full 14 days because you could still develop symptoms after the negative test. Quarantine ends after 14 full days from the last contact with a COVID-19 patient. Or if you get sick with symptoms, then you start isolation, which ends 10 days after your symptoms started, if you are better and have no fever for 24 hours. If you are taking care of a COVID patient and cannot separate from them with distance and mask, then your quarantine starts from the date that they are no more contagious and ends 14 days later. This is usually about 10 days after they got sick for a mild illness.